Cool. So we're here with Lucas.
Hello.
Tell me what you see, and then we'll see what we can do.
Yeah, so I've always had this little bump that I've wanted to get rid of.
Okay.
So that's like my main concern is like this right over here.
Okay.
So I don't know if it would be good to maybe like raise this or like.
Okay, so it's on a profile thing.
Yeah.
From the front, you're fine.
Yeah.
Okay.
It's really more when I turn to the side.
Okay. And is there one side that more so or another or?
I don't think so.
Yeah.
Like
I don't
both.
think so either.
Yeah.
So I think that in terms of this bump, in order to camouflage it, we got to inject above it.
Mm-hmm.
So bring this up a little bit like that, right?
Yeah.
And then I think so. And then we also should probably lift this up a little bit as well.
Just a little.
This whole area. So inject above and below.
Totally.
Because if I just injected above, I would have to lift this very high, and I think it'd start to look unnatural.
Okay.
So I want to inject down here as well, so that we lift this a little bit, and then lift this a little bit, and get a nice straight line coming down.
Sweet.
All right.
Sounds good to me.
All right. Cool. So I'm using small needles.
Okay.
I'm using. It's not gonna hurt.
Okay.
And I'm using Voluma. Voluma is hyaluronic acid filler. It's reversible anytime.
Okay.
So anytime we need to bring it down. If we want to bring it down, we can bring it down using an enzyme. It's really easy kind of thing to do.
Sweet.
If we leave it alone, it lasts for like a year and a half.
Oh wow.
So it's a good, long-lasting, kind of robust filler.
Awesome.
So it's good. It's a nice tool for this particular procedure. And then if we like this, and you will.
Yeah.
You'll
I'm
like
sure I will.
this.
Fingers crossed.
You'll like this. But then after it comes down, we can consider doing a more permanent filler.
Okay. Cool.
So have you thought about rhinoplasty, surgical rhinoplasty, or not really?
No. No.
I don't think you need to. I think this will be fine.
Yeah, I think
this will
so
be
too.
What you need.
Yeah.
So, and it's easy. It's like, there's none of the surgical risks.
Yeah.
It's a lot less expensive for people. It's
Mm-hmm.
totally.
Totally. I'm excited.
All right, cool. Take the ice top of your nose, and so we ice more to prevent bruising than for really pain-wise.
Okay.
But it also helps a little bit with the comfort of it.
Right.
Okay, tilt your head all the way back. Turn this way. Alcohol. Stick here.
Is that it?
That's it. That's the kind of thing,
I
right?
didn't feel it.
Cool. That's what people say. I mean, everybody has a little bit different pain tolerance.
Yeah.
And pain thresholds.
That's crazy. That was like nothing.
Yeah, for most people, it's really not a big deal. Good.
You doing okay?
Mm-hmm.
All right. Focus on your breathing. So how did you get into modeling?
So I was going to school in Arizona, and I got scouted on Facebook.
Oh.
Yeah, like a photographer like messaged me on Facebook, and he was like, "Hey, like I want to test out some equipment." I thought it was the weirdest thing ever. I brought my friend with me. I was like, "Is this how people get murdered?"
Yes, it is.
Yeah, I was like,
Actually, kind of
should I
is.
be? I'm like, Mom.
I used to take
That was
good notes.
interesting.
Oh, that's
So
good.
already
It worked out.
the bump is less visible. We blended it in from above, and so let's blend it in from below. Let's see what we can do.
Cool.
And we're looking for improvement, not necessarily absolute perfection.
Mm-hmm.
So because we'll see how if we can get it completely straight, or if it's just going to be close. A little stick here. You'll feel this a little bit more. Ooh.
Take a deep breath in. Good.
The tip is a little more sensitive, but it's still not too bad, right?
Mm-mm.
I actually think some of his imperfections are what make him like
Right, right,
interesting looking, or you know.
right. If you had a perfect nose, it would be kind of. I think it would be kind of.
Yeah.
How boring.
Mhm. Yeah, it's just like I don't know why the bump has bugged me for so long, like years. So finally, I was like, you know what? If I want to get this fixed.
So how did you find Dr. Rivkin?
A lot of my friends have come here before.
He's friends
Oh.
with Jasmine, Grace,
Griffin.
Griffin.
Yeah.
All right.
And I think like it's popped up on my explore page too. So.
Okay.
Oh,
Yeah.
cool.
That's good to know.
Mm-hmm.
All right, go ahead and ice it again. Doing okay?
Mm-hmm.
Okay.
Everyone that's friends with Jasmine are like our favorite influencers.
Yeah. The cool
Just
kids.
the nicest
Mhm.
and easiest to work with too.
Yeah.
Is that good?
Yeah, that's good. But I think that that's a really good. I think that's a good point in terms of perfection and imperfection,
Yeah.
because
Especially for models.
especially for models, but also especially for men, have like sort of
Mhm.
the eye likes. I think the eye likes a little bit of asymmetry and a little bit of imperfection.
Mm-hmm.
I think it's interesting because if it's all totally flawless and straight and stuff like that,
Boring.
it's a little boring.
And then we all just look like clones.
Mm-hmm.
Sorry.
It's okay. The pain really isn't that bad though.
Good. Yeah, you're doing great. We're almost finished. It's probably my distracting
Way
technique.
Mm-hmm.
Yeah.
You're killing it.
There's also lidocaine in the filler, so once it starts first few pokes, then it's,
Yeah.
gets numb.
Yeah, it's a little bit numb.
Mhm.
Good, that's a lot better
That's
already. Let's see the
amazing.
other side.
Hey, hey. Companies are coming after you now.
Yeah. New year, new nose.
I'll tag ASOS in our post.
Yeah.
Your future model.
Like, thanks, Westside Aesthetics.
That's it.
Just want to do one quick little thing over here.
Small part here. Deep breath in.
Can you see?
Mhm.
That I really didn't feel at all.
Good. Cool. So okay, so you saw here. Yeah, let's have you hold that for 1 second.
Okay.
So you saw. So I did injections up here and down here.
Okay.
In terms of the only thing I tell people to do is take it easy tonight. So don't work out, don't drink tonight, no aspirin or ibuprofen tonight.
Okay.
Tomorrow is fine. It's no problem.
Cool.
The only other thing is for in terms of sunglasses.
Mm-hmm.
If your sunglasses rest on the sides of your nose, like they usually do on those pads,
Yeah.
that's fine. If your sunglasses though are sitting on top of the nose
Okay.
and pushing down on it, then I'd rather not have you
Okay.
not wear them for a little bit,
So
for like
just
a week
avoid
or
it.
so. Yeah, if that's the case. If they're sitting on the side, it's no problem.
Okay.
I just want to not have pressure
Something.
on the top.
Yeah, yeah, yeah.
That's all. But here, let's have you take a look.
The big reveal.
Ooh, I like it.
Right? It's
Yeah,
still you,
it
and there's still a
is.
little bit of a bump, but it's
Yeah.
not nearly as extreme.
As like boom.
Yeah.
Yeah, yeah. No, I love it. So good.
Good. Okay.
Thank you.
I think that should be good. And then, yeah, I think that's really nice.
Yeah.